Okay, thank you very much. Hello, everybody. Welcome to my presentation on postural analysis of the hand in individuals with cervical spinal cord injury using egocentric video. My name is Mehdi, and I'm a PhD candidate working under supervision of Dr. José Zariffa and Dr. David Fleet. Next slide, please. Spinal cord injury, or in abbreviation SCI, is an unexpected and devastating medical condition that changed the course of a person's life. Studies ranking the preferred function priorities for individuals with spinal cord injury reveal that the improvement of hand function is a top priority. So given the importance of the restoration of hand function, particularly hand grip after CI, studies on the assessment and rehabilitation of the hand are important. The current clinical assessment relies on direct observation in clinical environments, and it doesn't reflect an individual's performance at the home. In other words, there is no information on the types of dexterity and patterns of manipulation used in various activities of daily livings at home, which prevents us to have a clear and individualized design goal for a hand robotics, and also prevents us to examine the impact of new robotics rehabilitation technology at their life. Therefore, a new outcome measures are needed to describe different domain of function in non-clinical environments. Next slide, please. Among all of the wearable technologies, wearable camera has a substantial potential to capture hand complex movement and also provide a platform that can be used to integrate multiple analysis, such as functional interactions and hand posture analysis. However, processing large amount of complex video data manually is incredibly difficult, emphasizing the need for automated data analysis. In the image in the slide, some examples of egocentric frame recorded at participants' home are shown. So our objective here is to build an algorithm that summarizes hand postures and grip strategies observed in egocentric video. The result will be used to generate a report to be interpreted by a clinician. In this presentation, I'm going to talk about two recent published papers. In the first study, we showed that the proposed method is able to track the use of tenodesis grasp. Tenodesis grasp is a grasping strategy that enables people with SCI to passively close their fingers using wrist extension, and thus can be used as a compensatory approach by those with reduced finger strength. Quantifying the use of the posture is an important consideration when assessing the impact of rehabilitation interventions. In the figure, we provide two examples in which one is using tenodesis grasp and the other is not. Our proposed architecture is shown in the study one section. After having an input image, we use object detection algorithm, YOLO-V2, to estimate hand locations. Next, we use open pose, which is a pose estimation algorithm to estimate 21 joint coordinates. Next, we design a new algorithm to estimate arm orientation, leading to estimate rest angle. We quantified the performance of the method using 17 participants. Our result showed that the method can provide a clear indication of which participants relied on tenodesis grasp, as is shown in the figure. Next slide, please. Tenodesis grasp is only one of the many hand postures that may be used by individuals with SCI. In the second study, we examined the potential of the method to cluster various hand postures using egocentric video. The architecture is quite similar to the first study. Particularly, first we localize hand and then estimate joint coordinates. Next, we use clustering algorithm to categorize similar hand postures. And finally, we examine the performance of the method. There is no single best clustering algorithm in general. Different algorithms are appropriate for specific problems. Therefore, we need to examine different methods to identify the best possible approach. A large number of clustering algorithms were tested, and the results show that Gaussian mixture model and spectral clustering acquired the highest performance among the examined methods. Cluster 1 and Cluster 2 in the results sections show 3 frames belong to the same cluster. Currently, we are working to refine the hand posture representation to obtain more precise clustering distance function to boost the performance, the method performance. Thank you very much.
Thank you so much, Mehdy.